Hi, I'm Dr. Jan Raytav. I work with heart patients every day. The one question I'm asked the most by my patients is, did stress contribute to my having a heart attack? Now, most of my patients already have a gut level feeling that stress was indeed important. They have that feeling, but nobody really talks about it, so they're not really sure how important it is. They're also afraid and confused after their heart attack. And they're certainly not sure what to do about stress anyway, so many just ignore it. You could be feeling exactly the same way. I've helped hundreds of patients understand and reduce their heart stress risks. And I wanted to give you the same opportunity that my patients have had. So I've launched heartstressrisk.com. This site will explain the stress-heart risk connection to you. But this site goes further than just talk about stress as a risk factor. I'm going to also give you tools that you can use to help reduce your heart stress risks. The first of these is the risk profile. Do you see a button on this page marked, "What is your risk profile?" It's directly below this video you're watching. Don't click it yet. I'm going to first give you the reasons why you'll want to get your risk profile report. I'm going to go over the research proof that confirms your gut level feeling that stress is indeed one of the most important factors that do lead to having heart attacks. The proof came from the INTERHEART study, a major international study that explored the main causes of heart attacks in over 15,000 people who all had their first heart attacks. So how does stress compare with all the other risk factors? Well, the top three factors accounting for most heart attacks worldwide were cholesterol, smoking, and stress. And in North America, stress was as important as cholesterol, and both were more important than smoking. So if your doctor wanted to help you reduce your overall risk of having a heart attack, he or she should spend as much time assessing and treating stress as they do spend assessing and treating cholesterol problems. So how does stress compare with other medical risks like high blood pressure and diabetes? Well, many of you will be surprised to hear that stress accounted for more heart attacks than high blood pressure and diabetes combined. And how did stress compare with other lifestyle factors like physical activity and diet? Well, stress alone accounted for over 30% of heart attacks worldwide. Physical inactivity and poor diet combined to account for only 26%. Think of it this way. The average North American adult could start exercising 3 times a week and be eating healthy meals, and they would still be more likely to have a heart attack than their twin, who decided to focus on stress reduction as their primary prevention strategy. So what did INTERHEART teach us? It taught us that heart attacks are more preventable than anyone ever thought. Up to 90% of your risk of having a heart attack can be reduced by focusing on 9 things, and stress is one of the biggest. But what stresses? Where do you begin? That's exactly the problem that my patients encountered time and again. They knew in their gut that stress was important, but they didn't know how to start and what to start changing. Doctors want to help, but they're very busy, and many are not familiar with assessing something as subjective and complex as stress. But what if you had an educational tool that helped you assess a number of stresses that large-scale studies had shown increase heart risks? And what if you had access to a report that gave you and your doctor information about the relative importance of these stresses? Many of you have a family history of heart disease. Some of you have already been diagnosed with heart problems. and some of you have already had a heart attack. It's quite likely that stress plays an important part in your risk profile. Doesn't it make sense to you? To reduce your overall risk of having a heart attack, you must measure your greatest risk for having a heart attack, and stress is one of the biggest. HeartStressRisk.com has provided you with an easily accessible way of evaluating your stress risks. How do you get your risk profile? Just click on the Risk Profile button on this page. When you do, you'll first be prompted to read and consent to the terms under which all this information is provided to you. Neither I nor Heart Stress Risk, Inc. provide medical advice or treat you as a patient. These videos and the risk profile are provided to you as informational tools. Tools that we trust will help you better communicate with all your doctors. After you've had a chance to read and understand all the information on the consent form, you have a choice to make. If you do consent, it opens up the risk profile questions themselves. This will take you about 15 minutes to complete. It asks you questions about your health, about your heart, and about your stress. In addition, there's 3 measurements that you'll need. The first of these measures is your neck circumference, or your shirt collar size. You can take this at the level of the neck, measured in inches. The second is your waist. That's taken at the level of your belly button, right around your body. And the third measure is your hips, taken a little lower at the widest circumference of your hips. So those 3 measures in addition to the questions about stress and health. Once you've answered all the questions, you click the Submit button. When you submit your questionnaire, it is compiled into your personal report. This will be sent to you by email. You'll receive it within minutes. If you're ready to get started, take your measurement and then click the Risk Profile button now.